we know that rural North Carolinians have been helped more by Medicaid expansion than anyone else. And you know, as I reach the end of my time as governor, I hold close to my heart the mission of getting people healthier. And I knew that getting Medicaid expansion passed and signed into law was the most important thing that we could do to accomplish that. But of course, it was never a given that we'd be able to expand Medicaid. It's a story that took many twists and turns, but through all of them, we knew that we could never, ever give up, and we did not. I went from getting sued by the legislature in federal court for trying to expand Medicaid in my first week in office to welcoming those same legislative leaders to the executive mansion on a beautiful spring day in 2023 to sign the Medicaid expansion bill that we had asked for. Talk about climbing a tall mountain. But the bill wasn't about them, and it wasn't about me. Medicaid expansion was always about the hard-working North Carolinians who desperately needed and deserved access to health care. So on December the 1st of last year, when Medicaid expansion went live, our state made a bold step that'll have a positive impact for generations to come. For the rest of my life, I will never forget being in Charlotte on that December the 1st, that day, and giving to a woman named Penny her brand new health insurance card. She was the very first person in the state to get one. There were tears in her eyes, and there were tears in mine too. Her path to health insurance had been long and painful. She had been willing to step up and tell her story publicly about why this was needed. And for years, she and hundreds of thousands of other working North Carolinians had been waiting and hoping and praying that our state would just say yes. All we had to do was say yes to expansion. Yes, we want that $521 million a month to help for health insurance in North Carolina. And for so very long, we had been fighting to take this monumental step. And as I said on that first day of enrollment, this was a dream, a decade in the making, that finally became a reality. It also unlocked almost $1 billion in new investments in mental health and addiction treatment that we know go hand in hand with staying healthy. That nearly 600,000 people have already enrolled just 1 year later is a remarkable accomplishment. And I am so grateful to the North Carolina Department of Health and Human Services, this team that is here, led by Secretary Kinsley and Jay Ludlam and others, and around the state, who got the word out to people, got people signed up in all kinds of ways, used that technology to let people know, bringing people in automatically. We wouldn't be this successful without all of you, and I thank you from the bottom of my heart. When I took office almost 8 years ago, I put forth my CEO mission. I wanted a North Carolina where people were healthier and better educated with more money in their pockets. That mission summed up the driving force behind every part of my administration in whatever area people happen to work. And Medicaid expansion really moved the needle on all three. People need to be healthy in order to get educated, to work at good jobs, to make money for their families. And while Medicaid expansion looms large as a major accomplishment in these last years, we've made tremendous progress on improving the health in other ways in our state through innovative, cutting-edge ideas. Let's take our Healthy Opportunities program. a first-in-the-nation effort to recognize that health care doesn't just happen at a doctor's office or at a hospital. We recognize that some Medicaid recipients had needs that, if addressed, would make them healthier, but Medicaid wasn't allowed to pay for it, even if it did save money in the long run. So we did something about it in North Carolina. North Carolina got approval to pilot the Healthy Opportunities Program and use Medicaid dollars for non-health care expenses that would both save money and improve people's health, the first state in the country to do it. So instead of an emergency room visit every month for an asthma attack, why not replace the moldy carpet in your home or install a new air conditioner if the old one is making you sick? Instead of missing medical appointments because you can't get a ride, let's pay for your transportation so that it can keep you healthy and out of the emergency department and out of the hospital. Instead of just telling you to eat healthy food, let's deliver it to you. People stay healthier and the state saves money in the long run. This effort started under then Department of Health and Human Services Secretary Dr. Mandy Cohen and continues under the leadership of Secretary Kinsley, who's working on these issues right now. And to date, North Carolina has served more than 26,000 high-needs Medicaid enrollees to keep them healthier and prevent illness rather than just waiting to treat it. Also high atop our innovations is our first-in-the-nation solution to get rid of medical debt. As Medicaid expansion reached more and more people, it was clear that they were really happy to finally have health insurance, but often had a mound of medical bills that they could never repay. Remember, this debt was not a choice for them, but because it was on the books, it kept them from getting credit cards, buying a home, sometimes kept them from even getting a job. And most of these people were honest and were deeply distressed about owing money that they couldn't afford to pay. It also often made people less likely to see a doctor when they needed one, even though they had insurance now, because they were afraid of the debt that they owed. So together, with feedback from hospitals and national experts, Secretary Kinsley helped lead our effort to craft a pioneering solution that relieves $4 billion in medical debt for 2 million North Carolinians, a plan that is now a roadmap for other states who have asked us, how'd you do it? Getting rid of medical debt will allow Medicaid expansion to live up to its fullest potential and its greatest promise. And we got there on all of it. Medicaid expansion, medical debt relief, healthy opportunities, and so much more. We got there because we never stopped believing that our work could make a difference. No matter how many doors were slammed in our face or how many people thought we didn't stand a chance, we knew that the dream of a healthier North Carolina could become a reality and that we have to keep fighting for it. From the first public university to first in flight, North Carolina has a storied history of innovation that's powered our people to reach our biggest milestones. And for the last 8 years, it's been an honor to lead our state through one healthcare innovation after another that will have a lasting impact on North Carolinians for generations to come. I want to thank you for the partnership. We're all going to keep working as hard as we possibly can, and I look forward to even greater success in the future. Thank you very much.